Welcome to the Empowering Patients podcast, your weekly take on all things related to new care models in healthcare, remote patient monitoring, chronic care management, and hospital at home. I'm your host, Theo Harvey, and I'm the co-founder of Synsormed, the leading full-service RPM platform in the industry. Today, I also have on the call our clinical manager, Ana Parrish. Hi, Ana. How are you?
Hi, how are you?
Great. Well, thank you for joining today. So we have a packed show today. Today we're going to get into a little bit discussing American Heart Month and discuss how to guide patients with monitoring their heart health at home. So this is a really important topic, and we're glad to have Ana on board to kind of discuss this. But first, let's get into the news. So the latest in healthcare news, Amazon Care goes national. For those that don't know, Amazon Care was launched in September 2019 to bring the most, patient-centric healthcare to customers when and where they need it. So Amazon has, started this program to work with employers to understand how to give the employees the best healthcare. And so what they're going to do now is basically provide access to range of services like urgent care, primary care, COVID testing, flu vaccinations, testments of preventive care, things to that nature. So one of the issues is if the issues can't be resolved via video, Amazon said they'll be actually sending individuals to the nurses to the patient's home, which is very interesting. So we'll see how this works. But Ana, as a nurse yourself who may have done home visits, how does that work? If you're trying to deal with patients, especially in remote settings and trying to guide them through nurse type of healthcare environments.
Right. So it's always a challenge when you are kind of going into a patient's home and you're in their setting and you're trying to do any kind of health care that they may need. I think that people are used to Amazon, and so they're used to kind of that instant gratification, and they know the name. So that's definitely a plus for them, I think, that they have going for them. But then on the downside to that, it's kind of like, well, we know Amazon delivers our packages next day, but how good are they with healthcare? Like, can we trust these people? So I think that might be a challenge they may have, but I do see them doing well with it. I think that as long as they have a strong clinical team and the people know who they're doing, patients will be receptive, and it's definitely a convenience for them.
Yeah, that's a great point. I think Amazon, look, getting into healthcare is always a good thing because they do have a supply chain understanding. They know how to move things around pretty quickly, as we saw during the pandemic. But I think unfortunately, healthcare and big tech companies, there's a graveyard of a lot of them have tried different things and they just didn't be successful. For instance, Microsoft. I don't know if you remember, they had remote records that people could take with them and they could bring into the doctor's office. They tried that. That wasn't success. IBM Watson, that was supposed to be a big thing in healthcare, this AI type artificial intelligent computer that's going to give you your diagnosis. And the IBM said, hey, we can change healthcare. They end up selling off this unit and, for a big loss because they couldn't get any big clinical systems to join up with them. So that was a failure. And Amazon themselves, they tried this previously with Haven Health, where they work with Berkshire Hathaway, which is Warren Buffett's company, and Google to create kind of like this kind of employee kind of healthcare, but it disbanded after about a year. So, I commend them, to get into this space, but it's very hard to kind of do healthcare, as we both know, as ones who work in this industry. And so you just can't throw a lot of money at it and expect it to be successful. So to your point, having a good clinical staff, having great workflows is really key. And it's not just about the technology all the time.
Yeah, definitely. And I think another thing that's important is Amazon, since they haven't been in healthcare, there's so many guidelines, there's so many restrictions, HIPAA, all these things that come into play. So you kind of have to know your stuff, and you have to make sure your staff knows what they're doing. So I think it'll be interesting to see how it plays out with them.
Yeah, I do. And also, one of the things that comes up is what happens when employees want to keep the doctor they have of Amazon, even if they change jobs, right? Or what if they come to Amazon, they say, do I have to use the same, facilities and everything for the care? So I think it's going to be a hybrid model where people are still going to have to insure, do everything, but then Amazon may help them with their urgent care needs or something like that. But it's still a lot of issues. I think what we've seen that could work, if a lot of the primary care doctors, specialists really focus in on kind of helping patients and keeping that relationship with them, I think that would be key to helping for the future because
Right.
a lot of the patients, if they don't know their doctor, then of course they're going to be kind of out of sorts. So we'll see how this evolves over time. More to come on this, but this is very interesting for this market right now. So with that being said, let's go and get into our feature today, and we'll talk a little bit more about American Heart Month. So with American Heart Month, and I know you brought this up to our team about how this is important. This is a special month to understand heart, having healthy heart habits, especially for our patients who tend to be in the Medicare age. So can you walk us through how are you currently educating patients on their heart health?
Yes, so heart health is definitely important, and it plays a huge role in what we do here because we do monitor patients on their blood pressure, and then we have scales too, which I think some people forget is related to heart health because if they have congestive heart failure, one of the major things that we have to look for is fluid overload. So, are they retaining fluid? So, we have these devices, we have a team of nurses who are making sure patients are adhering to kind of lifestyle things that will benefit them and benefit their health. So we're definitely making sure that they are paying attention to their diet, meaning they're eating fresh fruits, vegetables, staying away from processed packaged foods, and limiting their sodium intake too, which is really important.
Mhm.
Um, and then another thing that we're really kind of honing in on is stressors. We know that, sometimes patients they only see their doctors maybe once every 3 to 6 months. With our team, they're talking to us weekly, biweekly, or monthly. So we kind of get a better idea of what their home life is like,
Mhm.
um, what their stressors are. And so just kind of educating the patient on coping techniques, whether it's reading, taking a warm bath, drinking warm teas, exercising, things that can just promote healthy heart, lower their blood pressure, lower their cholesterol, and just their overall health.
That's a great point. Stressors. I think we all kind of deal with that in our daily lives, and so, how are the patients responding to this? Right. So is this new information for them? Is it something they've heard before? And then, really on the flip side, what are the results? Are we seeing patients get better, BP readings over time?
Right. So I definitely think that patients respond well to it. It's definitely something that we don't see overnight. We would have to just reevaluate in the next 30 days when we call them again and say, hey, I noticed your blood pressure readings are looking great. And they'll say it's because I'm limiting my sodium intake, or, since our last conversation, I haven't been eating out as much and I've been trying to stay home and cook. So we definitely see the benefits in it. And we can tell when we go look at a patient's readings and they have a really high reading. We call them and they say, I really wasn't listening to you. I ate something. I have one patient in particular who's like, I love my McDonald's fish fillets. So he eats those and he knows he shouldn't, but at least he knows when you know better, you do better. And
Mhm.
so it's just kind of taking small steps, even if it's cutting back once or twice a week and then slowly increasing that. So we definitely see the patients responding.
I love it. I love it. And so, I think education is really a big part of it, and just reminders to help the patients. What are you seeing? Are you seeing anything with patients understanding? Are they open to kind of sharing this knowledge with others? One of the things that we're looking to evaluate is how patients can communicate with each other, right? And so, do you see that the patients who are doing better, do they feel like, hey, I feel like I understand how to do better with my heart health? Is this something I'm willing to share? I'll be curious to get your thoughts on that.
So I definitely think, especially when some patients, when they live with families, maybe they're geriatric patients who live with their children and grandchildren, they're definitely sharing that knowledge with them, and making sure the whole household is eating healthy. And for them, it's not so much maintenance, but preventative because they may not have these chronic conditions. And then, of course, I'm sure that they're sharing it with their friends. I have one patient in particular who he always exercises at the YMCA. And so he's making sure that his buddies on the bike next to him are doing what they're supposed to do too. So I definitely think that there are patients who are being proactive in their communities, in their homes, and sharing the information that they have that's helping them with their health.
I love it. I love it. Well, look, Anna, thank you for your time today. I appreciate it. This is just to give everyone a sense of, these weekly podcasts, just a little snippets on what we do here at Synsormed, but more importantly, how you can help your patients and empower them to live better, healthier lives. So please like and subscribe on our Apple Podcasts, Spotify, Stitcher, wherever you listen to podcasts. We also do this via YouTube as well. So follow us on Instagram, Twitter, and LinkedIn at Synsormed. Thank you all for being on this journey with us to better empowering your patients to better health. Thank you for your time, and we'll catch up with you soon. Take care. Bye.
Bye.